Hello.
Hi there.
Hi, my name is Sebastian. I'm a Harper nursing student. Is it okay if I do a head-to-toe assessment on you today?
Go for it.
All right, very good. Can you tell me your name?
Adam Garrison,
And can you tell me your birthday?
July 25th, 92.
Do you know where you are right now?
In somebody's home.
Somebody's home. Do you know whose
You're
home
my
it is?
friend's home.
Okay. And do you know why you're here?
For a head-to-toe assessment.
Okay. And can you tell me who the president is right now?
That Cheeto guy. Donald Trump.
Cheeto guy.
Donald Trump, yeah.
Donald Trump. Okay, very good. So I know that my patient here has a level of consciousness, A&O times 3. He's learn-oriented. He responds well to my questioning here. So as I'm assessing him, I'm taking a look at his skin color, and I can tell that he is well perfused because he doesn't have any signs of cyanosis, pallor, jaundice. His skin color is appropriate for his ethnicity. As he was communicating back to me, I was noting his speech habits, and there was no slurring or any types of miscommunication or errors. So, can you just stand up for me real quick? Can you tell me how tall you are?
I am 5'10",
And do you know how much you weigh?
about 155.
Okay, so that puts you at about a BMI of about 22, which is normal. It's not overweight, underweight, and it looks that way, so that's good. What I'm actually going to have you do is just take a look over here, and would you go ahead and just read the line that says 2020 on the Snellen eye chart test over here?
A-E-I-O-U.
Okay, very good. And so, are you able to read any of the letters underneath it?
Z-Y-X-W.
All right, so what we'll do is we'll go back to the 2020. Do you use any corrective devices?
I do have contacts in.
You have contacts in. Okay, we'll make note of that. All right, so after that, what we're going to do is I'm just going to have you, we're going to take your blood pressure, heart rate, I'm going to count your respirations. Do you mind just handing out your arm here? And then I'd put the blood pressure cuff on this arm while I'm testing. So then I'd be checking. And so then I would receive vital signs that would be all within normal parameters. So the next steps that I'm going to take, I'm going to go ahead and assess my patient's head and face. I'm going to say that my patient's head and face are normal cephalic. There is correct symmetry. There's no reason that no signs of injury or anything like that that would indicate he had facial trauma or head trauma. So I'm going to go ahead and begin by palpating the skull, and I feel that his hair is full and that it's not frail or anything like that. As I'm palpating the skull, I don't feel any contusions or hematomas, so no head trauma in that regard. So I'm just going to ask you to close your eyes real tight for me, kind of raise your eyebrows and open them up. Smile, show me your teeth, and frown. All right, very good. So cranial nerve 7 is intact because there are no deformities in that regard. The next exam I'm going to do is palpate the temporomandibular joint, so go ahead and open and close your mouth, wiggle it side to side. Any pain or tenderness when I do that? Okay. And then the next exam we'll do is just a palpation of your sinuses. How does that feel? Any tenderness?
No.
I don't feel any swelling. What about here?
No.
So I've checked both the frontal and the maxillary sinuses. The next step that we'll take is I'm just going to have you follow my pen light in 6 different directions, and just let me know if you have any difficulty, okay? I'm going to be watching your eyes. So just follow my pen light with both of your eyes. All right, very good. The last test, just follow it as it comes in towards your nose. Okay, very good. And then the next, I want you to close this eye while I cover it, and I'm going to shine a light. I'm going to check for reaction. That's good. Close your eye there. All right. So both of his eyes are perla. So we have intact cranial nerves 3, 4, and 6. Perla standing for pupils that are equal and round and reactive to light and accommodation. The next exam that I'm going to be doing is just closely examining the sclera in both of the eyes. I don't see any redness or irritation, no jaundice, no signs of cyanosis. Just go ahead and look up for me. And I'm taking a look at the conjunctiva, and it's showing good perfusion, so telling me that he's does not have any like bleeding disorder. The next exam that I'm going to do is I'm just going to perform a whisper test. I want you to tell me back what you hear.
White socks are the worst.
Alright, so I'm going to check the external ear condition, and I'm just going to take a look in the internal meatus. How do you have any tenderness as I feel your ear here? So I feel the pinna and the auricle. There's no any signs of lesions, no redness, no erythema, nothing that would be abnormal, no pain or tenderness either. So I'm looking at the mouth, and the first thing I see is the lips. So I see that they're pink and well perfused. There's no cyanosis. They're not dry or dehydrated. So go ahead and open your mouth for me. I'm checking out all the mucosa on the back uvula, the roof of the mouth, the buccal mucosa. Just go ahead and touch your tongue to the top of your mouth. All right, it's shiny on the floor of the mouth. The gums are well approximated to the teeth, and the teeth are all present. There's no decaying teeth. Go ahead and say ah. I see that the cranial nerve 9 and 10 are both, what would you say, intact because the floor or the roof of the mouth rose when we spoke ah. So go ahead and stick your tongue out as far as you can. I have no midline shift, so that's good. Or it's well approximated down the midline. There's no shifting to either side, so cranial nerve 12 is intact. Okay. So, sorry, the neck. So the next exam we're going to be taking a look at is the neck. So I'm going to be taking a look at all of the glands. The first ones would be the parotid glands. All right, I don't have any pain as I palpate here.
Nope.
I don't feel any swelling, so that's good. What about the salivary glands?
Nope.
All right, and then the thyroid gland?
Nope.
All right, I don't feel any tenderness, swelling, or any shifts in that either. So that is a good thing. So the range of motion, I want you to raise your chin to the ceiling, bring your chin to your chest, turn your ear to the left all the way, to the right all the way. Now bring your left ear to your left shoulder and your right ear to your right shoulder. All right, very good. So the next exam we'll be doing is a palpation of the rest of the lymph nodes. So I'm going to be checking the pre-auricular. I don't feel anything. The post-auricular, the occipital, the submental, the submandibular, the jugular-digastric, the superficial cervical, and then the deep cervical, post-cervical chains, and the supraclavicular. I don't feel any abnormal swelling in any of those regards. So that's a good thing. Shows no abnormalities, such as a sign of infection. I'm going to check your carotid pulses, so just kind of turn your head for me just a little bit. Okay. Both pulses are well approximated bilaterally, about 2 plus 3 plus pulsations, which is good. There's no bounding or heave in the neck there. So I'm going to go ahead and give the carotid arteries a listen. So don't mind me. Just go ahead and hold deep breath. On the other side here. Okay, with either of those, I do not feel any cardiac or carotid bruits or any whooshing or anything like that. So with the range of motion, I want you to test. Just raise your shoulders up against my hands. All right, very good. So cranial nerve 11 is fully intact. Upper extremities, I'm going to take note immediately of a tattoo that is on the left arm. Did those heal well for you?
Yeah, no infection or anything.
No problems with that. All right, so what I see immediately is that I don't have any other signs of lesions or anything like that. The skin is well colored, well perfused. That there's no obvious deformities, missing limb, anything like that. I'm going to be touching the arms here. The arms are warm and dry. No, no edema as I feel them as well. So if you just don't mind kind of holding out your hands for me, I'm going to check out your nails. First thing I'm going to be taking a look at is profile signs, making sure that there are no signs of clubbing, so that does not exist. And what I would do here is just check for the capillary refill after that. So far everything is underneath 3 seconds for the refill. Check the thumbs, that would be last. Alright, very good. So those are all normal signs. Next thing I'm going to check is the radial pulses, if you don't mind just keeping your hands out here. Okay, very good. So I have a heart rate of about 60, but the pulses in both radial pulses are, both radial arteries are 2+, so they're not bounding, there's nothing abnormal, no arrhythmias or anything like that. With the range of motion, that's the next test that we're going to be doing. So I want you to bring your arms up all the way above your head for me. Alright, very good. And now bring them back behind your arm, behind your back. Alright, any pain, crepitus, tenderness, nothing like that?
Nope.
Difficulty moving? Okay. Next thing I'll have you do is bring your arms out here. Go ahead and flex and extend. Bring them over, now under. Okay, kind of flex your fingers in towards me. I'm going to pull. Alright, and same thing, flex your arms up all the way again. I want you to pull against me with your arms. Okay, and then push against me with your hands. Alright, very good. The next test will be of your hands. So I want you to bring your wrists all the way back. Now your hands all the way down. What about your fingers? You spread them all the way apart, bring them back together, point them down, point them all the way up. Okay, very good. Alright, so now that we've completed your full assessment of your arms, I'm just going to ask you to remove your t-shirt if you don't mind. So I'm going to do an assessment of both your heart and your lungs. So an immediate thing that I see upon examining the chest is more tattoos. So those all healed well for you?
Yeah, no problems.
Alright, very good. So I'm just going to ask you to take a couple normal breaths. Just stand here as most relaxed as you can. I'm just going to watch. So the immediate things that I see upon the inspection are that the respiratory rate is normal. It's not labored. It's 16 respirations per minute. I counted 8 within that 30-second span. The rhythm is normal. You're not breathing too rapidly, too slow. The depth does not use any accessory muscles, so you're taking nice, normal, deep breaths. Sorry, you took a look at both the anterior and the posterior aspects of the chest I watched, and both lung sides are symmetrical. So I'm just going to go ahead and give a listen. As I place my stethoscope on each location, I just want you to take like a semi-deep breath here, okay? Okay. So, all the sounds are clear in the front side, so I'm going to go ahead and listen posteriorly. Do the same thing. Take a couple of moments to just take a normal breath here or two. Alright, here we go. Very good. Now listen to your left side here. Okay. Your right side. Alright, very good. So, all your lung sounds are clear. As I listen to them, I hear bronchial sounds in the regular areas, which would be up here. Those sounds are a little bit longer on expiration and shorter on inspiration. So, bronchiovesicular sounds as well in the middle areas of the lungs, and then vesicular areas, which are much softer, but no signs of crackling or wheezing or anything like that. So, very good. The next thing I'm going to examine is just your heart. So since you've got a little model here for me, I'm just going to go ahead and base it off of that. So just going to find your apical rhythm. I'm going to listen to your heart for 60 seconds. Just go ahead and just relax and normal breaths here, okay? So during that full minute, I counted 72 heartbeats, and I did not hear any S3 or S4 sounds, no murmurs, no heaving, no signs of galloping or anything like that. So your heart has a normal S2, S1 and S2 sounds, which is your normal lub dub. So that would indicate no arrhythmias. So the next couple of things, I'm just going to listen specifically to some areas in your heart called the valve areas. So we're going to listen to the aortic, pulmonic, the tricuspid, and the mitral valves. So I'm going to start off with the diaphragm. Start here. It's the tricuspid here. Or the pulmonic, excuse me. This is the tricuspid. This is the mitral. Same thing, I heard S1, S2, so I'm going to flip it over to the bell side, and I'm going to listen again. So no abnormal sounds were heard. I did not hear any S3, S4 type sounds or any signs of dysrhythmia or arrhythmia. So I'm just going to have you go ahead and lay down, if you don't mind here. We're going to check out your jugular vein. So if you don't mind actually kind of raising your body up to about 30 degrees. So I'm going to take a look at the jugular vein and ensure that there's no venous buildup that would indicate a distension. So as I examine both sides here, I am not seeing any of that. Okay. So I'm going to move on to the abdomen. If you don't mind, I'm going to lay you down just a little bit more. As I look here, I'm going to check out the symmetry and the skin characteristics. I want to make sure that the abdomen is not distended or that it's abnormal. I don't see any abnormal pulsatile masses. I do see a slight sensation above the midline, which is indicative in normals, adults of a healthy aortic artery. So how do you feel in your abdomen? Do you have any pain? No? Do you mind if I go ahead and give it a listen?
Go ahead.
Okay. So I heard normal bowel sounds in all 4 quadrants. So the next thing I'm going to go ahead and do is just, I have to listen to your aortic artery. So I'm going to flip it over to the bell. So in the renal arteries, I didn't hear anything, which is a normal sign for a young man like you. With the aortic valve, very slight sounds, but nothing that would be indicative of any bruit or like an aneurysm or anything like that. So that's good. So the next thing I'll do is just do a light palpation. Is there a quadrant that you would like me to start in?
Go ahead.
Neither? Okay. Any tenderness or pain as I touch here?
Nope.
Okay, so the next exam that I'm going to do is just a deeper palpation for your organ. No pain? No pain? Tenderness? Nothing? Alright, very good. Alright, so I'm going to have you stand back up. You can go ahead and put on your shirt. Alright, so I'm just going to have you take a seat right here and we're just going to examine your lower extremities. Do you mind taking off your socks and rolling up your sleeves?
Pants.
Alright. So as I'm taking a look at the legs here, I don't see any obvious signs of deformities or any lesions. I see an old scar right here, but that seems to have healed well. How do your legs feel? Do you mind if I take a look?
Go for it.
Alright, so I don't see any venous problems in the back as I'm taking a look on this foot here and on this leg here. I don't feel any pretibial edema, which is good. And the legs have even hair distribution. It is warm and dry to the touch, which is normal. And I'm going to move on, and I'm going to feel your pedal pulses here. Good. We have even pedal pulses on both legs. I'm going to go ahead and take a look at each toe here, and I'm going to check for capillary refill. Good. 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 Okay, so all of those are even and less than 3 seconds for capillary refill. I'm going to check your range of motion in your legs now. So go ahead and lay down here. Have you bring your right hip up with the straight leg all the way up. Alright, very good. Same thing with your left leg. Okay. Do you mind bringing the leg out here? And backwards, and then try it as far as you can against the couch this way. Alright, very good. I'm going to have you move your ankles up towards you. Your toes, point your toes towards you, I'm sorry. And then point away from you. Kind of bring your feet out, bring them in, touch your toes together. Alright, very good. And now push against against the gas pedal and pull up against me. Alright, very good. So strength in all of those muscles are good. Range of motion for all of the joints are good as well. So, I'm going to have you stand up again. Alright, so next exam that we're going to do is a light touch exam. So I want you to close your eyes, and I want you to tell me when you feel me touch any part of your skin, okay?
No. 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 No.
Alright, very good. The next exam is going to be sharp and dull discrimination. So I'm going to give you two different types of feelings. So if you stick your hand out, this is going to be sharp.
Mm-hmm.
This is going to be dull. I want you to close your eyes, and I want you to tell me what you feel.
Okay.
Okay?
Sharp. Sharp. Dull. Sharp. 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 Dull. 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 Sharp. Sharp. Dull. Dull. Sharp. 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 Dull. Sharp. Sharp. Sharp.
Alright, very good. Alright, so the next thing I want you to do is put your finger on your nose, and I want you to follow my finger, and just go ahead and move your finger back and forth between your nose. Alright, very good. The last test with your hands I want you to do is touch your fingers to your thumb in sequential order. Very good. Okie dokie. So I'm going to have you run your heel against your shin on the opposite leg, all the way down to the ground. Same thing with the other one. Very good. Alright, so I'm going to have you sit down here. I'm going to test your reflex. Just let me go get my hammer device. Alright, if you bring your elbow up to me here, I want you to fully eliminate your shoulder weight. Alright. Very good. And the other arm. Alright. If you don't mind bringing your pants down just a little bit, just so I have an more even surface. Alright, so I want you to pull against your fingers here while I do this exam, okay? And try to relax your legs as much as possible. Okay, very good. Alright, so if you don't mind laying down again, I have to test your Babinski reflex just for a quick second. So what I'm going to do here is just bring this foot out. Sorry. Okay. Now the other leg. What I'm looking for here is to make sure that the toes don't fan, and that's good because they're not. So that would be indicative of some sort of brain injury. So if you don't mind walking towards the wall over this way, and walk back in a straight line, heel to toe fashion. Alright, very good. So I want you to close your eyes now and just stand straight. And I'm going to be watching for any swaying. I'm going to watch this for about 20 seconds. Alright, and then you can go ahead and open your eyes. You don't mind walking a couple steps forward? Sorry. I'm going to check out on the curvature of the patient's spine. So what I'm looking for is the locations of the shoulders, the infrascapular notch, the hips, and the knees to make sure that the patient's spine is aligned. And I can see that it is. So I'm going to go ahead and ask you to bend and try and touch your toes. And I'm watching for the same type of alignment. And I see that all the cervical vertebrae are in alignment here. So once I'm going to ask you to stand up once more. And then we're going to check for your range of motion. So just go ahead and bring your hips to your side. Now to your other side. Forward. Oh no, not forward, I'm sorry. To the without just turn your shoulders into the other side now. All right, very good. Well, I'm all finished. If we're all set, so thank you very much. I appreciate it.
Thank you.
Yeah.